This is Healthcare-Associated Infections in Intensive Care Units and Prevention in Developing Countries by Rachel Nygaard. The highest incidence of healthcare-associated infections, or HAIs, has been documented in admissions to intensive care units. Healthcare workers in intensive care units must practice these hygiene protocols, determine any barriers, and find motivation to maintain or improve practices. Patients in intensive care units, or ICUs, are especially at risk to HAIs due to more compromised immune systems, low compliance with infection prevention and control measures, and a high workload and low staffing ratios. While following policies and procedures for the control of HAIs may be currently practiced, it can also deter from safety if protocols aren't followed correctly or aren't effective in controlling infections. A gap in the literature relates to which method of preventing these infections is most effective in intensive care units. In this research, the policies and procedures to reducing HAIs will be examined in a literature review to determine which method is most effective. Healthcare-associated infection surveillance programs are critical for infection prevention. The organization change theory used in this study provides a theory for the process of adopting and implementing these protocols. This systematic review of prevention strategies for HAIs in intensive care units will summarize the current most effective strategies and recommend a pathway for the development of a new HAI surveillance program. The research questions that will be addressed in this study are: what are the most effective policies or procedures in reducing the risks of HAIs in intensive care units in second and third world countries? And also, what are the barriers to implementing this policy in intensive care units in developing countries? The hypothesis states that processes and strategies for that health policies and programs that are adopted and maintained in formal organizations will lower the incidence of HAIs. This research will suggest that specific guidelines and policies need to be adopted, implemented, and maintained in order to lower the risk of HAIs. The research methodology in this study includes a systematic study design that was used to review the findings of research studies that compare healthcare-associated infections in ICUs located in developing countries to the compliance of units following infection control policies and procedures, and the most effective policy for preventing HAIs and what barriers exist. For inclusion criteria, types of HAIs used for this research study are the types identified by the CDC. I included both qualitative and quantitative studies. Excluded criteria were studies in which the infections were not acquired in healthcare settings, or ICUs, and studies which were done in first world countries. Articles conducted over 10 years ago were excluded as well.